May is American Heart Month, a time to raise awareness about the risk of heart disease and encourage heart-healthy habits.
Heart disease is the leading cause of death for women in the United States and can affect women at any age, but it can be especially concerning for women experiencing menopause and perimenopause. So joining us now is Dr. Heather Shenkman, an interventional cardiologist who focuses on heart health and menopause. Good morning. It's great to have you with us this morning, Doctor.
Good morning. Thank you so much for having me to talk about this important topic.
It is so important. And so my first question to you is, what are the changes that come with menopause specifically that can also increase heart disease and heart health issues and concerns for women?
So with menopause, there is a significant change in our hormones, specifically estrogen. Estrogen levels drop. And as a consequence of these changes, there is a change in our bodies. We will experience symptoms like hot flashes and difficulty sleeping. There are also changes in our weight and can be changes in blood pressure. Blood pressure tends to go up a little bit. Our cholesterol levels, particularly our LDL cholesterol, will also rise. And as a consequence of these changes, there is an increased risk of heart disease. Now, women in general have a lag behind men in terms of risk. So men tend to be younger when they have heart disease and heart-related events. But as women, we catch up very quickly around the time of menopause.
And what age are we talking about, just kind of a ballpark, the sweet spot, if you will, where those risks are the highest? And what can women who are experiencing menopause do to reduce that risk?
So menopause on average occurs around age 50, but there is a broad range of ages around that time where menopause can begin. In terms of reducing risk, it really comes with lifestyle. Now, lifestyle change, it's never too late to start having good heart healthy habits, but certainly the younger, the better. So making sure that you're following up with your doctor regularly, that you are aware of your blood pressure, cholesterol, and glucose levels, that you're eating healthfully, eating plenty of fruits and vegetables, eating a more plant predominant type of diet, getting regular exercise. And the recommendations for exercise are 150 minutes of moderate exercise per week or 75 minutes of vigorous exercise per week. And just being mindful and knowledgeable of our symptoms. If you feel something that's out of the ordinary, talk to your doctor. Also habits. So things like smoking, if you're a smoker, quitting is so critical to adding years and quality to your life, minimizing alcohol consumption, getting enough sleep, managing stress.
All of those things can be very daunting, though, for someone who, let's say, wants to really start paying attention to managing their heart health in particular in their 40s or their 50s. So what would the number one thing that you would recommend to women be if they want to start going down a healthier path, if you will, especially women, again, in their 40s or 50s?
I think the easiest thing to do in terms of making lifestyle changes is to be more active. And that can be as simple as starting to walk more. I mean, walking is such a low investment habit to start. All you need is a pair of good walking shoes and to get out the door. Even something as simple as a 5-minute walk each day during the lunch hour can provide significant benefit to overall health and well-being.
Great tip to get us started.
Absolutely, and as always, consistency is the key. Dr. Heather Shenkman, thanks so much for these very helpful tips to focus on our heart health, particularly for women.
Thank you.